We've been talking for days now about the latest hospital crisis, how bed and staffing shortages threaten to overwhelm them as Omicron makes its way through the state.
There's another piece to this puzzle, though. Patients waiting to leave, but nowhere to go. Naomi Coles explains.
Older patients recovering from COVID or other procedures often need short or long-term rehab at skilled nursing facilities. But like the hospitals, those homes don't have the staff to keep up.
It's a huge issue.
We cannot jeopardize the care and services that those individuals need.
Inside Scotland Retirement Services in Stoughton, CEO Chris Krentz says their staff is down 15 to 20% of their pre-pandemic workforce.
It was a pre-existing problem, and I think the pandemic has only exacerbated it.
The CEO of Leading Age Wisconsin agrees. The shortage started before last March, but since it's gotten worse. And now, as 600 patients wait in overcrowded hospitals for nursing home beds, it's becoming rapidly more urgent.
We're not able to admit many of those patients because we cannot admit people for whom we have no staff.
Throughout the pandemic, Krentz says they've done pretty well keeping the virus out. But all that can change in a day.
I come to work every day knowing that, a couple positive tests could mean we go into lockdown again without visitation. Residents could be positive, staff could be positive. I could lose the next percentage of the workforce. How am I going to get that covered?
About 1,600 long-term care beds have been decommissioned in Wisconsin since last March because there's not the staff to man them.
That will mirror the exodus of people working in long-term care.
There's not one silver bullet that's going to fix this. It's going to be a bunch of little things.
First and foremost, increasing wages. Krentz says they're fundamentally limited there.
The Medicaid system in Wisconsin has been broke for a long time as far as reimbursement. We don't get our costs covered, so we can't afford to pay our workers as much as the Quick Trips and Walmarts of the world either.
John Sauer says there's other things. Short-term, like temporary workers, and long-term, building incentive and adding state funds to encourage people to enter the industry. Now, are vaccine mandates for staff playing a role? Already in place for many and could soon be federally required for regulated homes in every state. John Sauer of Leading Age Wisconsin estimates that may have played a role for 5 to 8% of staff statewide, but he attributes the bulk of departures to larger industry trends, starting and then exacerbated by the pandemic.